Welcome to the deep dive. Today we're going to be looking at iron deficiency anemia, and we're going to try to, really break it down and make it easy to understand for anyone who might be dealing with it or wants to learn more about it.
Yeah, it's a really common problem, and a lot of people don't even realize they have it.
Right? They might just feel a little tired and not really think much of it.
Exactly.
So let's start with the basics. What exactly is anemia?
Okay. So you can think of your body like a busy city with, billions of these little tiny citizens, which are your cells, all working hard. And just like any city, it needs a good transportation system to deliver these supplies. And in this case, the supply is oxygen, and the transportation system is your red blood cells.
So the red blood cells are like those delivery trucks you see zipping around, bringing oxygen to every corner of the city.
Exactly. And then anemia happens when your city doesn't have enough of those delivery trucks, or if the trucks aren't working properly. And iron deficiency anemia, which is the most common type, that's like having delivery trucks, but they have weak engines, so they can't carry as much oxygen as they should.
I see. And why is iron so important for those engines?
Well, so hemoglobin is a special protein inside red blood cells that acts like a magnet for oxygen. And iron is a key ingredient in hemoglobin.
So without enough iron, those hemoglobin magnets aren't strong enough, and the red blood cells can't deliver enough oxygen.
Exactly.
Okay, so that's why people with anemia might feel tired or weak. Their cells aren't getting enough oxygen.
Yeah, and they're practically gasping for air.
And speaking of strange things, have you ever heard of people craving ice or even clay?
Yeah, it's a real thing. It can actually be a sign of iron deficiency anemia.
Really?
Yeah, it's called pica, and we don't fully understand why it happens, but some researchers believe it might be the body's way of trying to get the iron it needs.
Wow, that's wild.
Yeah.
So even if your symptoms seem a little weird, it's important to pay attention to them and get them checked out.
Definitely.
But let's get back to iron itself. How do people become iron deficient?
It often comes down to an imbalance between the iron you take in and the iron you lose.
Okay.
So we get iron through our diet, mainly from foods like red meat, leafy greens, and beans. But sometimes our bodies lose iron faster than we can replace it.
So it's like a bank account, right?
Yeah.
You need to keep making deposits to cover your withdrawals.
Exactly.
What are some of the big withdrawals when it comes to iron?
One of the most common is blood loss. Blood is full of iron, so if you're losing blood, you're also losing iron.
Yeah.
Heavy periods are a common cause in women, and sometimes there can be bleeding in the digestive system that you might not even notice.
Hold on, bleeding in the digestive system that you don't notice? How is that possible?
Yeah, it's called occult bleeding, and it can be caused by things like ulcers, polyps, or even hemorrhoids. And these conditions can cause small amounts of blood to leak into the digestive tract, and you might not see any visible signs of it. Colon cancer can cause bleeding, and so if you have bleeding from a colon cancer, you're going to be losing red blood cells, and you can develop iron deficiency anemia because of that.
So you're literally just losing blood.
You're losing blood, yeah.
And that's making you anemic.
Correct.
Now, when we talk about colon cancer and bleeding, a lot of people probably think of like bright red blood
Right.
when you go to the bathroom.
That's what we all worry about.
Yeah.
Yeah.
Is that what we're talking about here?
So not necessarily. Sometimes you can have what we call occult blood loss, where it's a very small amount of bleeding that you don't see.
Okay.
It's kind of hidden in this
Okay.
tool.
Yeah, so this is like microscopic amounts of blood.
Yeah, it could be very small. And, in the right setting, like with right-sided colon cancers,
Yeah.
especially you can have this kind of slow, insidious blood loss that you might not even notice.
So you could be losing blood and not even know it.
Right.
And that's where the anemia comes in.
Exactly.
Wow. Okay, so that's really scary.
Yeah, it can be.
So how do you even know if you have occult bleeding?
That's why it's so important to get checked out by a doctor if you have any symptoms of anemia, especially if you're a man or a woman who's gone through menopause, because they can do tests to see if there's any hidden bleeding going on.
So it's not just about how much iron you eat. It's also about making sure you're not losing iron without realizing it.
Exactly.
And then there's also the issue of iron absorption, right? Like even if you're eating plenty of iron-rich foods, your body might not be absorbing it properly.
Right. There are several reasons why that might happen. Certain conditions like celiac disease can interfere with iron absorption. Some types of weight loss surgery can also affect how your body absorbs nutrients. And even something as simple as a vegan diet, if it's not carefully planned, can lead to iron deficiency, because plant-based iron isn't as easily absorbed as iron from animal sources.
So it's not always a straightforward problem with a simple solution.
Right.
You really need to get a proper diagnosis from a doctor to figure out what's going on.
Absolutely. Trying to self-diagnose and treat yourself with iron supplements can be risky.
Right.
You don't want to end up with too much iron, which can be just as bad as not having enough.
That's a good point. Too much of anything can be harmful. Speaking of diagnosis, how do doctors actually figure out if you have iron deficiency anemia?
Well, it starts with a simple blood test called a complete blood count, or CBC. It's a very routine test that checks different components of your blood, including your red blood cells and hemoglobin levels.
I had that test done before. It's pretty straightforward, right? Just a quick prick of the finger.
Not quite a finger prick, but yeah, it's a very common and simple blood draw.
Okay.
And if the CBC suggests that you might have anemia, your doctor can order additional tests to specifically measure your iron levels and see how well your body is storing iron.
Okay, so the CBC is like a first clue.
Yeah.
And then further tests help paint a clearer picture.
Exactly. And sometimes, especially if the cause of the iron deficiency isn't obvious, your doctor might recommend tests to check for any internal bleeding, particularly in the digestive system.
So it's like a detective story, piecing together the clues to find the root of the problem.
Exactly. And once the diagnosis is confirmed, the next step is figuring out the best way to address the iron deficiency.
That makes sense. But now let's talk about what you can actually do about it. If you've been diagnosed with iron deficiency anemia, what are the next steps?
Well, the first step is to figure out what's causing it in the first place. Is it blood loss? Is it poor absorption? Or something else entirely?
Right.
And once you know the root cause, you can start to address it directly.
So it's like fixing a leaky faucet. You don't just keep mopping up the water. You find the source of the leak and fix it.
Exactly. A great analogy. Treating that underlying cause is key. But in the meantime, you also need to replenish those depleted iron stores. And that's where diet and iron supplements come in.
Okay, so let's talk about diet first. What are some of the best foods to eat if you're trying to boost your iron levels?
Well, there are a lot of delicious options out there. Red meat is a great source of heme iron, which is the type of iron that's most easily absorbed by the body.
So steak lovers rejoice.
Exactly. And if you're not a big meat eater, don't worry. There are plant-based sources of iron too. Leafy greens like spinach and kale are packed with iron, as are beans, lentils, and tofu.
I've also heard that vitamin C can help with iron absorption.
That's right. Vitamin C acts like a booster. It helps your body absorb iron more efficiently. So try squeezing some lemon juice over your spinach salad or having a glass of orange juice with your iron-rich meal.
Those are good tips. But let's be realistic. Even if you're eating all the right foods, sometimes diet alone isn't enough, especially if you need to bring those iron levels back up quickly.
Yeah, you're absolutely right. In a lot of cases, iron supplements are necessary to replenish those stores more efficiently.
Okay, so let's talk about iron supplements. There are different types available. How do you know which one is right for you?
That's a great question, and that's where your doctor comes in. They'll consider a lot of different factors, like how severe your anemia is, any underlying health conditions that you might have, and of course, any potential side effects to help choose the best supplement for you.
So it's not a one-size-fits-all situation.
Definitely not. There are multivitamins with low doses of iron that might be suitable for prevention or very mild cases. But for more significant deficiencies, your doctor might recommend a higher dose iron supplement, typically containing around 300 milligrams of elemental iron.
300 milligrams, that sounds like a lot.
It is a significant dose. And that's why it's so important to follow your doctor's instructions carefully. Don't just grab any iron supplement off the shelf and start taking it.
And I've heard that iron supplements can have some side effects like constipation.
Yeah, that's true. For some people, iron can be a little bit rough on the digestive system. But there are things that you can do to minimize those side effects, like staying well hydrated, eating plenty of fiber, and maybe even taking a stool softener if you need to.
Okay, good to know. And what about those iron infusions that we talked about earlier? When are those typically used?
Iron infusions are generally reserved for more severe cases of anemia or when someone is having trouble absorbing iron from oral supplements. So, for example, if you have celiac disease, which affects nutrient absorption, or if you've had certain types of weight loss surgery, your doctor might recommend infusions.
So it's like bypassing the digestive system and delivering the iron straight into the bloodstream.
Exactly. The iron is given intravenously, usually in a doctor's office or clinic, and it's a safe and effective way to quickly replenish iron stores.
That makes sense.
Yeah.
So let's talk about the timeline for recovery. How long does it usually take to start feeling better once you've started treatment?
Well, it varies from person to person, but many people start to notice improvements within a few weeks. They might feel less fatigued, they might have more energy, and their skin might regain some of its color.
So it's not an instant fix, but you should see some positive changes relatively quickly.
Exactly. But it's important to remember that even if you start feeling better, you need to continue the treatment as directed by your doctor. We're not just trying to treat the symptoms here, we're trying to fully replenish the body's iron stores, and that takes time.
How much time are we talking about?
It could take several months, sometimes even 6 months or longer, to completely replenish those iron reserves. Your doctor will monitor your progress through blood tests, checking your hemoglobin levels and ferritin levels to see how much iron is stored in your body.
Okay, so it's a marathon, not a sprint.
Yeah.
But how do you know when you've taken enough iron? Like, is there a point where you can stop taking the supplements?
Absolutely. Once your blood work shows that your iron levels are back to normal and your iron stores are replenished, your doctor will probably advise you to gradually reduce your dosage or stop taking the supplements altogether.
Okay, that's reassuring to know. So it's not a case of taking iron supplements forever.
No, not at all. It's about reaching a point where your body can maintain those healthy iron levels through diet and by addressing any of those underlying causes of iron deficiency.
This is all incredibly helpful information. I feel like we're finally getting a handle on this iron puzzle. But are there certain groups of people who are more prone to developing iron deficiency anemia?
Yeah, definitely. We already talked about how women who are menstruating are at higher risk because of blood loss during their periods.
And what about pregnant women? I imagine their iron needs would increase during pregnancy.
You're absolutely right. Pregnancy puts a big demand on a woman's iron stores because iron is essential for both the mother's increased blood volume and for the developing baby. So that's why prenatal vitamins typically include iron.
That makes sense. Now, we talked earlier about how men generally don't need extra iron, but are there any exceptions to that rule?
Well, there are a few situations where men might need iron supplements, like if they've had significant blood loss from surgery or an injury, or if they have a medical condition that's affecting their iron absorption.
So it's not a hard and fast rule, but generally men don't need to be supplementing with iron unless there's a specific reason.
Right. And it's always a good idea for men to consult with their doctor before they start taking any iron supplements just to be safe, because too much iron can be harmful.
We've talked about the potential downsides of having too much iron. Can you explain a little bit more about why iron overload is a concern?
Sure. So our bodies have a limited capacity to get rid of excess iron. So if you're consistently taking in more iron than you need, it can start to build up in organs like your liver, your heart, and pancreas.
That doesn't sound good. What kind of problems can that lead to?
Well, over time, iron overload can damage those organs and lead to some pretty serious health problems. Things like liver disease, heart problems, diabetes, and even joint pain.
Oh, that's definitely something to be aware of. It really highlights the importance of finding that balance right. Getting enough iron, but not too much.
Exactly. It's all about finding that sweet spot. And that's why it's so important to work closely with your doctor and get regular blood tests to monitor your iron levels and adjust your treatment plan as needed.
What are some of the new things that researchers are looking into for treating iron deficiency anemia?
That's a great question. Researchers are always looking for new and better ways to diagnose and treat this condition. One thing they're really focused on is developing new types of iron supplements, supplements that are gentler on your stomach and easier for your body to absorb.
So no more constipation or black poop.
That's the idea. There's also a lot of exciting research happening in the world of personalized medicine,
Oh, wow.
where treatments are tailored to your specific needs based on your genes and your individual situation.
So instead of a one-size-fits-all approach, you get a treatment plan that's designed just for you.
Exactly. And it's not just about finding new treatments, it's also about improving our understanding of iron deficiency itself.
Right.
Scientists are really trying to figure out how iron absorption works and how our bodies use iron, so we can potentially even prevent it before it becomes a problem.
That's amazing. So much to look forward to. But for now, what's the most important thing you want our listeners to remember from our deep dive into iron deficiency anemia?
I think the biggest takeaway is to listen to your body. Don't ignore fatigue or other symptoms just because you think you're run down.
Yeah.
Pay attention to those little signs, and if something feels off, talk to your doctor. A simple blood test can give you so much information and help you get on the road to feeling better.
Because those little signs might be telling you that you have iron deficiency anemia.
It really might. And remember, knowledge is power.
It really is.
And before we sign off, I want to give another shout out to the Center for Digestive Health and Nutrition. Their website is an amazing resource for anyone who wants to learn more about digestive health, with tons of information, articles, even recipes. It's all there.
So big thanks to them for all the great work they do.
Yes, thank you.
Well, thank you so much for joining us for this deep dive into iron deficiency anemia. It's been a fascinating journey. And all our listeners out there, thanks for tuning in. Stay healthy and keep on learning.